I want to share a story that will show you that healing autoimmune condition can be very different for different people. I learned it very quickly when I was diagnosed 11 years ago with autoimmune thyroid condition. I got Graves in this lottery of autoimmune disorders. And about the same time when I was diagnosed with Graves, one of my colleagues also was diagnosed with the same issue. We were very similar, both neurodivergent. If you are neurodivergent, chances are that your immune system and your nervous system going through turmoils since you were a child. It's additional pressure for those systems. We both worked for the same company, quite stressful job, but really satisfying. And constantly we were overstimulated. I would say having life that we had, it's easy to develop overactive thyroid because you're pushing yourself all the time and every day is like a new life for you. And so those are similarities, but we also had differences. So gender difference. We also had age difference. He was my senior, I guess 15 or 20 years. Age is relevant in this case because I would say that attitude that we have towards healthcare system, towards health itself, we have differences, like tiny differences, not only because of different personalities, but also because of differences in time where we were born and when we formed our understanding of what health and science is. So in his perspective, when you're sick, you go to the doctor, the good doctor, and then you have your diagnosis and your protocol, and then you implement the protocol, and that's the healing. If it doesn't work, then the protocol needs to be changed. And then if the doctor is not finding good protocol for your healing, then you look for another doctor. That's the process of healing. The trust in healthcare system and in science is paramount. So my approach is a bit different. I trust science. I know that science is developing. I don't think that healing is the responsibility of a doctor. Doctors, they need to diagnose me. They also provide me with the protocol of the treatment or management. Then my job is to understand my issue as deep as I can understand. So I would make my disease or my disorder my special interest. All possible causes, explanations, treatments. I will read everything that I can find. I will talk with everyone that I could think that maybe this person possibly knows something about the issue that I have. I will watch lectures and I would take classes. I would watch YouTube and any video of a person who had this issue and maybe found some solution. So I would absorb all this information, be interested in nutrition, all possible connections between lifestyle and the issue that I have. In perspective of my colleague, things that I would do would be too much, too exhausting, too stressful, and not necessarily grounded in respectable science. I would be interested not only in medication, but I also would read about herbs, Chinese traditional medicine, Ayurveda, anything, like anything, give me anything. And the protocols that we got, me and my colleague, they were different. If you have overactive thyroid and you have Graves, which is autoimmune disorder, there are different treatment protocols. In my family, people got their thyroid removed. Part of the thyroid was removed. I have people who were never diagnosed with anything, but then when now they are in their 80s, doctors say, oh, but you don't have thyroid at all. The immune system destroyed your thyroid sometime, we didn't notice that. I saw people taking medication, not taking medication, so different approaches. Always want to know arguments why this approach should be taken, not the other one. So we went to different doctors. Situations were very similar initially, but because of different treatments, there were some differences, and also our understanding of our role in the healing was different. In both cases, it worked. Whenever we would meet in a corridor, we had the similar way of talking, so we would just start to talk random things, and sometimes we talk health and thyroid. Anytime I would tell him what I'm doing, he would tell me, oh wow, that's radical, that's really kind of extreme. Whenever he would tell me something, I would say the same. I would say, oh, it's so radical. We both looked at each other with kind of respect and a bit of mistrust. Both knew that our plan works for us, but it would probably not work for the other person. We would never push anything to each other, like we would never give advice to each other. We would just share respectfully. One of the treatments he received was radioactive iodine. It is destroying the thyroid, that is overactive. Then he received medication that was also quite powerful, and when I was going to visit my endocrinologist for the first time, I was afraid that I will be prescribed the same medication, but my medication was completely different. I had to take it for months. It was also doing some harm to my immune system. It was doing nothing to my antibodies. It was just preventing my thyroid from producing hormones. In both cases, both those medications worked. I was implementing a lot of changes in my nutrition, and also I started to do audit of my life, because the more I learned in the classes that I would take about autoimmunity and about thyroid, the more I understood that it is very connected with the lifestyle. Yes, Epstein-Barr virus is important, but the lifestyle matters. In Graves' disease, it's not only that the thyroid is overactive and that it is producing too much of hormones. The other issue is antibodies, and the medications I'm taking do nothing in this field. My lifestyle needs to be different. The third thing was understanding the connection between the brain and the thyroid. There are a lot of factors in autoimmune disorders. When it comes to thyroid and when it comes to Graves' disease, in my case, I saw clearly by doing the audit of my life that I was doing in the first months after diagnosis, I realized that my body is just responding to my needs. I made a video about the symptoms and the reasons of those symptoms that I had. I put the link below. When I learned about the connection between the hypophysis, between the master gland in the brain and the thyroid, I realized that no, I don't only need to work with my body and thyroid, I need to work with my thoughts, because my brain is actually telling my thyroid the same thing that I'm telling myself every day. I need to work better. I need to work more. I need to do more. I'm just making demands to myself so high that my body is not able to cope with them. I need to work not with my executive function, but I need to work with those demands. I need to find the source where those demands are coming from. So I need to meditate. I need to journal. I was doing all this stuff, and also nutrition. I was eating this, not eating that. I was drinking this, not drinking that. Monitoring everything. And for my colleague, everything I did was like so complicated. It's not worth. Nobody can guarantee you that anything of this works. It takes time. There is no like real scientific ground for that. In his eyes, there was no scientific ground. But he was not like contradicting me. He was just saying, you do you. But he would just ignore all those things. In both cases, we were very successful. In his case, situation changed. Well, thyroid was not active. They had to take other medications after the treatment. In my case, I was free of medication, but we both felt that we achieved what we wanted. We wanted to change the situation, and we wanted to change it in the way that we understood that we can be proactive in doing that, and we both achieved results. We both also have another problem. Thyroid eye disease. It's quite common to develop it. In my colleague's case, treatment with radioactive iodine was also a factor in developing of this disease. And in his case, the situation was a bit worse than in my case. When you develop the eye disease, eyes are kind of protruded, pushed from the orbits. Sometimes people develop double vision. The optic nerve is pressed. What that means is that you see not one, but two. It's prohibited to drive when you have this condition, but some people drive even having this double vision. That's why we need to be very careful when we cross the street. I felt some decline in my vision also, but there was no double vision. But eyes were very like pushed away, and there was a strong tension in the eyes. Or during the night, sometimes it was pretty difficult to close the eyes. Yeah, that was a bit scary. Both were reading what can we do in this situation. He was advised some medications again, but he read that in this case that he has the surgery is the best option. He tried to find the doctor. In the beginning it was difficult, but finally he found the doctor in the best healthcare facility. The doctor did operation, everything went fine, healing was fine. He was okay and he was very happy, and he came back to work from the hospital glowing and being very happy. In my eyes, the operation that he went through was really, really radical. So I was reading like, is there any other possibility? What happens why the eyes are pushed away? There's a lot of inflammation going there. The treatment would be to lower the inflammation as much as possible. Omega-3, but at the time I was so almost crazy. Now probably I would just take fish oil and that's it. But at the time I was like, no, I will not take fish oil. I'm not sure about fish. No, I will take flaxseed oil. So I was taking flaxseed oil religiously. I'm very lucky, I'm very privileged. I live in a country where people still farm, where it's possible to find fresh flaxseed oil. And I lived like 500 meters from farmer's market. So every 2 weeks I would go to farmer's market. I found one lady, she was selling carrots and apples, and also she was selling flaxseed oil from one small farm. It was amazing. It was so fresh. The taste was delicious. Before that, I only tasted the flaxseed oil that I bought from the shop, and it was terrible. It was bitter because the flaxseed oil is oxidizing very fast, so it becomes bitter very fast, and it is not as useful as a fresh flaxseed oil. It went to the point that she would see me, take the bottle and give it to me. I told her that this is for my eyes, that I am healing by lowering the inflammation, and I explained her why I need the fresh oil. There was 1 week when I came, she took the bottle, she was giving it to me, but then she looked at the date. The date was a week, like a week old flaxseed oil. And she said, no, no, no. And she gave me the bottle of that day. The quality of flaxseed oil that I was taking was amazing. I was taking it with salads, but I was taking, it's like a spoon of the flaxseed oil. Also, I was taking selenium, and it helped. And also other things helped. Colorful fruits, colorful vegetables, a lot of fiber. Everything helped me. It took several months. My eyes went back to the places. They're not the same as they were before Graves, but they are much better. And it took several months, but for me it was easy, it was joyful, it was delicious. But for my colleague, too complicated, too long, too much hustle, placebo, not the real thing. Both of us helped ourselves, and our doctors helped us. But they were doing it in different ways, and we also did it in different ways. Both we were very happy about the healing process. That's my main message. If at this moment you're doing something and you feel that this is helping you, but then you see other person with a very similar condition doing something totally different, and you kind of like, oh, should I just switch? You know, maybe you are just doing things that are helping you because you have a trust in them and you feel in control. And because with autoimmunity is a lot of about ourselves. It's not like our body is the mechanism that is separated from us as people, as persons. It's very connected, interconnected. Feeling that I had about the process that my colleague was going through gave me stress. Even to think about things that he went through, that was stressful. For him, everything I did was weird, kind of woo-woo. Nutrition, like, you know, like people say, if nutrition would be helpful, everyone would be very healthy. But they're not. But for sure, if someone would deny my colleague the treatment that he thought he needs, that would give him a lot of stress, and he would find my methods and my path extremely stressful. You know, flaxseed oil, farmer's market. That's basically what I wanted to say. So now when I work as a nutrition teacher, some of clients that I meet, they also have autoimmune conditions. Sometimes they don't even know that they are autoimmune. Some of them even have thyroid conditions, but they don't know if they are autoimmune or not because nobody spoke with them about that. They want to know more about nutrition, but I never push any agenda. I don't try to like, I'll teach you my way. It's not like that. Every person has their own way, and especially with autoimmune conditions, very often it's body telling us that our life can be better. Not only that our health can be better, but our life can be better. Trust in doctors is important. I trusted my doctor. I had few arguments with him, but in general, like, I really trusted him, and I'm grateful. I'm grateful to the nurse I met in his office. She also gave me a lot of wonderful suggestions. I am grateful to my family and to my friends, but I also am grateful to myself. Just like my colleague, oh, I'm sure he is grateful to himself. He fought for the treatment that he thought he needs. So if you're interested in healing and nutrition and facing autoimmune conditions as our friends, not our enemies, follow for more.